So if you've been following the news, you'd have heard about bird flu and what's been happening in the United States, and then humans getting bird flu and in the United Kingdom. What's going on? Director of the National Influenza Center, Dr. Michelle Brown, joins us, and she's going to be discussing avian influenza, its causes, effects, and prevention. Good morning, Doc.
Good morning.
Welcome to Smile Jamaica.
Thank you, and thanks for having me.
All right, so let's start first of all with what it is. And how does it differ from other types of influenza?
Okay, so the natural reservoir for influenza A that causes bird flu, right? There are birds and wild waterfowls. Now, these viruses can affect birds as well as humans. Now, many years ago, you had changes in this influenza avian virus, and it started affecting humans. So we have strains like H1N1 and H3N2 that are responsible for the seasonal influenza. So predominantly the avian influenza affect birds, but we have the seasonal influenza that are caused by different strains such as H1N1 and the H3N2. And these are responsible for the seasonal influenza that we have.
Okay.
So usually towards the end of the year, people become sick and get the flu. So these are caused by the strains such as the H1N1 and the H3N2 that circulate among humans by close contact, respiratory droplets. So you find persons in close proximity to each other will become sick from these viruses.
So you'll find that at a certain time, I think closer to the end of the year.
Yeah, usually that's winter,
yeah.
right.
Even here in Jamaica, you'll find more people at that time saying,
yes,
you know, we're having the flu because it's spread that way. But and you said respiratory droplets.
Respiratory droplets, so sneezing, coughing.
Yeah.
You know, if the droplets are on surfaces and a person touch these surfaces without washing the hands and touch the face or the mucous membrane, they can become infected.
So what have they identified as the causes for bird flu? Is it a similar thing? And why is it now such a concern for humans?
Okay, so it is a concern for humans because with bird flu, you can have changes in the virus. The virus can change. And in areas where there are poultry farms, so this virus can spread to poultry as well as dairy. So for handlers, for poultry farmers, for dairy farmers who become exposed to respiratory droplets, secretions, droppings from these birds, from the animals, they can become infected. In fact, we have had cases, there are sporadic cases that do occur. And when they become infected, they may present with signs, even though they might be mild. But the problem, however, is that if this bird flu continues to change its structure, it can eventually affect humans, and you'll have human-to-human transmission. And usually over the years, there are severe consequences of being infected with the bird flu, such as death. So we have to be careful. Yeah,
I mean, as I read in the introduction, there have been cases and concerns raised in the United States and in the United Kingdom. But if I've learned nothing from Zika, CHIKV, COVID, I've learned that this world is one global place.
Yes.
Should we be concerned here in Jamaica?
Yes, we should be concerned because migrating birds, they can transmit the virus. They can carry the virus as well. And we should be concerned because for the first time last year in 2024, the virus was found in cattle. It started infecting cattle. Cattle workers, cattle farmers who were in close contact with these birds became infected. Even though the infections were severe and they were not severe, it's a cause for concern. Because if we have outbreak, the consequences can be very dire.
Yeah.
Yes.
I'm going to ask a weird question. You may or may not be able to answer, and if not, it's okay. But I'm thinking, what happens to infected cattle which is why I don't like predial larceny, because if you steal a cattle and you kill the cattle and then it enters into the market while infected, is that a problem for me as a human who consumes it?
Well, as I said before, it can affect cattle. So if the cattle is infected and you consume that meat, you can become infected. And that is why the Vector Services Division, they are doing close surveillance and close monitoring of our poultry and our livestock to ensure that there's no infection. The virus is not found in the livestock to prevent infection.
Please.
So there's always a risk.
So I just want to underscore that the Veterinary Services Division in Jamaica has a program the cattle passport, so that you know that when you're consuming meat, you know, it's been passed by the inspectors and everyone. Predial larceny is not good. It's not just the farmer can get hurt. You can consume meat that you're not supposed to. So be careful.
And if I may add, Dale.
Yes, please.
So we also have the veterinary division and stakeholders in the poultry industry.
Correct.
They are working together. And they're doing close surveillance, both commercially and locally. Because you know that we have some persons who have their little fowl coop at the back of the house and they have the little poultry farm going on. So they're doing close monitoring. And from time to time, samples are sent to their laboratory and testing is done to ensure that there is no evidence.
Yeah.
And thank God, so far, we have not had any evidence of infection.
Yeah.
Also, we have the fisheries departments. We have NEPA being involved. They are testing migratory birds. If dead birds are found, those are monitored. Samples are sent to the veterinary division to check if there are any signs of infection. So we are doing close monitoring. And from a human perspective, the Ministry of Health, the National Influenza Center, we are doing a robust surveillance system to ensure that there are no evidences of avian influenza.
So I'm going to ask one next question.
Sure.
Might sound so righted. Like, how do you detect if it's in the poultry though? The chicken don't sneeze.
Chicken can sneeze.
Them sneeze?
Yes, they do get sick. And the comb of the chicken can change from red to blue. So if you notice that there's a change in the comb of the chicken from red to blue, that's a sign. The chicken becomes sick, they become droopy, and they may actually die. So these are signs that we need to look for, because they can be indicator.
Look at that.
There are some
I think the
cases
poultry
of it.
farmers know what to look for, but poor me, I wouldn't know. So in adults, I'm guessing that the signs of the influenza may mirror the signs of other types of influenza, but what would probably differentiate it for you to say, no, this is bird flu as opposed to H1N1 or something?
All right, so as you rightly said, the signs are similar to the seasonal influenza that we get. So you'll have the cough, you'll have the sneezing, you'll have the runny nose, you might have the headache and the joint pains. But one of the signs that was noticed was a conjunctivitis or a red eye. So from the cattle became infected, it was noted that conjunctivitis was a sign that was seen in persons who were infected, who handled the cattle's conjunctivitis was one of the main signs.
Which we like to call pink eye.
Pink eye or red eye,
yes,
right. And just to note that even though the infections are mild in human, there can be cases where you have severe infection. So the person or patient may present with seizure, shortness of breath, altered mental status, and these are signs that we need to look forward to.
Yeah, because it's respiratory, yeah?
It's respiratory, so it can affect the lower respiratory tract. In some cases, it can cause a pneumonia. And we have to monitor these patients carefully. You may have death resulting in some severe cases, so we have to be careful.
Well, I like to tell people, you know, if you know you have NCDs, the non-communicable diseases, if you know that you typically have respiratory issues, the certain time of the year, you know, guess what? Stock up on your vitamins, do what you have to do to protect yourself more than the average person.
Definitely, because for influenza generally, most of us who are immunocompetent, we have good immune system and we take our vitamins and we're healthy. We get over the flu in a couple of days. We have mild illness, we take some antipyretics for fever, and we get better. However, in the elderly persons, the persons who are immunocompromised, persons with underlying conditions, it may take a more severe course. So these persons have to be monitored carefully.
All right. So what types of treatment is available? Is there a vaccine against the bird flu? I know they do flu shots in the States, and some do here.
Yeah, we have the seasonal. We have the vaccine for seasonal influenza here. So generally, for influenza, we can do our supportive treatment. So you have a fever, you take your paracetamol, you hydrate. In terms of specific antivirals, there's Tamiflu or oseltamivir, which has to be given within a certain period of time and in certain patients with certain underlying conditions. There is a vaccine that is available, a candidate vaccine that is available. However, it is not being distributed generally now. However, if there was to be an outbreak, this vaccine is readily available for use. And this is in population that is at risk that would get this vaccine. There's a vaccine available for the poultry, in the poultry department, that can be given to fowls.
Yeah.
Yes.
Wow, Doc, you really covered it all. For persons who are watching and they want to get more information, not just on bird flu, but on other types of influenza or other things, is there a website we can go to, a number we can call? What do we do?
Okay, so you can visit the Ministry of Health website, Ministry of Health and Wellness. There's a CDC website. There's a WHO website. And Dela, I must add that this is a collaborated effort. So the National Influenza Center works along with the Veterinary Division, the Ministry of Health. So the Veterinary Division, they have their website and they have their information as it regards of veterinary services. So Ministry of Agriculture and Fisheries, through the Veterinary Division, they have their brochure, they disseminate their information. The Ministry of Health website, they have their information. And you can also go to WHO website, as I said before. So there is knowledge out there. We want persons to be informed. We want persons to know, for example, the little farmer in St. Elizabeth who has a chicken poultry farm at the back of his yard. If he sees signs of sickness in his chickens are getting sick, the production of egg has decreased, he needs to contact the Veterinary Division. For persons who are aware of wild birds and are in close contact, if you're seeing wild birds sick and dying, contact the Veterinary Division. So the information is there on the respective websites for persons to be informed.
Thank you, my love.
And I'm sorry, Dela, I can't end without not really saying a big thank you to the Center for Disease Control and Prevention, the Pan American Health Organization. They have been very instrumental in providing support for the National Influenza Center and the Ministry of Health in helping to monitor or surveillance practices for bird flu. And as a result, there is containment, and we can be rest assured that if it were to be here, based on our surveillance system, we'll readily be able to recognize and respond to such a situation.
Excellent. Thank you very much.
Thank you for having me.
So she's a guy, you see, the passion that she has about protecting us. All right. Director of the National Influenza Center, Dr. Michelle Brown. That's it for 10 Minutes to Your Health.